Hey guys, happy Monday. Happy Monday to you guys. Let me see. Andrea is already in the chat. Hey Andrea. Andrea said hi, Miss K from Chesapeake, Virginia. Hey. I guess there's no streaming tonight. I was here. Oh, I'm here, Andrea. I think it shows up on YouTube before I even go live, but I don't know if you're still here. What time is it? Oh, you left about a minute ago, but I'm here, Andrea. She said, I guess there's no streaming tonight. No, I'm here. I think it shows up for you guys as soon as I create the thing. Let me no, never mind. All right, guys, let's get into it. Is this Machiva? Hello, Alexis. What's going on, Alexis? Oh, let me leave the call-in link for anybody who wants to come in. Let me share the link, the call-in link for anybody who wants to call in. And you guys can hear me, right? Y'all can hear me, right? Call-in link. Oh, she said I was wondering because I checked Facebook too. I know that's right, Andrea. As soon as I create the link, as soon as I create the live stream, I think it automatically pops up. So you must have gotten notified that I was about to go live. Hey, Jasmine, long time no see. Hey, Jasmine. Let's see. You know what's so funny? I literally, look at you. You already on it. When I tell you, I literally was going to ask y'all to give me some video ideas that you want me to talk about. Definitely. And let me bring something up really quickly. Let me make a note. But I left the call-in link for anybody. Let me bring up my notes app because I literally was going to ask you guys. So you guys know I just moved. I'm not in the classroom right now. So I won't be able to make anything clinical related right now. But if it's something that you guys want me to talk about, I am going to do that. So I'm adding it here. So you said infection control. I think I already have a video on that, but if not, I'll definitely do that. All right, let me make this big enough. I see a couple of people called in. Let me see. Hold on. I'm going to have to come. Hold on, guys. I see Alexis and I see MJ. Hold on one second, guys. I'm gonna get to you guys in 1 second. Let me do this. Let me keep it on here. And then I'm trying to think, how do I do this? All right, let me see. I'm going to add you, MJ. I see you came up first. Let me take this off. Add to stage and then do this. Okay, say something, MJ.
Hi, Miss K. How are you?
I'm good. How are you? Can you guys hear MJ? You guys confirm in the chat for me. Hold on before you ask your question. Okay, I just want to make sure they can hear you. Do me a favor, guys, and confirm in the chat that you can hear MJ because I don't want him to ask his question and you can't hear him. Do me a favor, confirm in the chat. Let me see. Okay, they can hear. Okay, what's going on, MJ?
I'm good. How are you? I just
Pretty
passed
good.
my certification. I wanted to know.
Congratulations.
Thank you. I appreciate it.
You're welcome.
I wanted. Oh, you were a big help, by the way.
Oh, okay. Good to know. Congratulations.
So my question is, where has there been a time where you felt like you had a really crazy situation, and how did you like deal with it?
You mean like at work?
Yeah.
So I had a situation I had a few. So I'll tell you, one of them, I had a very racist patient that he kept insisting on calling me a certain, well, not necessarily me, but referring to Black people a certain way with the N-word. And what I did was I excused myself and I went and got my nurse manager right away. So I did not match his energy. I could have, but I didn't. I immediately got my nurse manager. Then I had another situation where my coworkers and we were all called the B word. And another, we got the nurse manager. So when I get in situations like that, because sometimes there are patients who are irate, who are disrespectful like that. And what I do, I don't, and that's actually a test question too. They ask you, what do you do? But I don't match the energy. I just politely, I excuse myself and then I go get the nurse manager. And now we've had a time where we had to actually get security as well. So those are a couple situations. Is that what you mean, like with patients?
Yes.
Yeah. So if
And
you
I
have go
and
ahead.
I had like another question. I wanted to know
Mhm.
like as a first time MA, because it's like my first time in the healthcare field. My whole
Uh-huh.
family's in it, but I wanted to know like what's some advice that you would give somebody just starting out.
So just starting out, what specialty are you going in? Do you already have a position?
I'm just like an MA.
Okay,
It's
so you have
not like specialty really.
no specialty word. Okay, so for somebody just starting out brand new, I would say, you know, do a little research, figure out what specialty you want to get into. I think family practice is a really good one to start out with because you get to do a lot of different things. You want to see the whole family, you want to see the kids, the parents, teenagers. You're going to be helping out with physicals, giving a lot of injections because you're going to be doing a lot of vaccines. Seeing the kids and the babies. And that kind of gives you an idea what specialty you want to, if you want to stick to family practice, or you might realize, oh, you know what? I like doing EKGs. I want to go into cardiology. And then be open too. So although I mentioned family practice, be open, right? Because when you're a brand new MA, you do want to be open um to a practice that's willing to give you a chance, right? And so I always say, take the experience. So let's just say you want to go into family practice, but you can't get into family practice and you have cardiology willing to hire you. Take the job in cardiology. So just take the experience you can get while also applying to another specialty, and then just be teachable. So when you go in there, when you guys do get your job, whether you're going into your new job or your externship, just make sure you go in there with your notepad in hand and just be ready to learn. Take notes, look at videos. That's going to be big. I know you guys learned your clinical skills in school, but I definitely recommend looking at videos. For depending on what specialty, if you're going in cardiology, looking at EKG videos, and then also looking up videos for tips on how to, like for an example, if you're going into pediatrics, like looking up tips on, and that's something I can probably do a video on too, just looking up tips on how to, calm a child that's afraid, or when you got to give them shots or draw their blood. um and then also getting extra certification as well. So I know you guys, when you finish school, you get your certification. A lot of people stop there, but I recommend, if especially depending on what specialty you're going into, if you want to work in a lab, get your phlebotomy certification. If you're going into cardiology, get your EKG certification. So stock your credentials. Um, what else? It's so much I can tell you guys as a new MA, but just be teachable, do some research on a specialty you want to go into, also look into recruiting agencies too. So those of you that's fresh out, brand new MAs, you looking for jobs, recruiting agencies get paid to find you a job. So I always say, start there. Start with recruiting agencies if you don't get hired in your externship. And then of course you got Indeed and everything else. So hopefully that was helpful, MJ.
Thank you so much. Yes,
You're
it was.
welcome, and congratulations
You're
again. Hold on,
you're
hold on before.
very inspirational.
Thank you. Let me give you, hold on before you leave real quick. Wait a minute. Let me just give you something real quick. Where's my sound? Wait a minute. Wait a minute. Wait a minute. Just before you leave.
Thank you. Thank
You're
you.
welcome, MJ. Okay, Alexis. So let me know, Alexis. I see you got your camera on. If you want to, well, actually, I don't have to show you. So let me know. Just say no, you don't want to be on camera. Yeah. Okay. All right. So once I bring you up, do me a favor, turn your camera off for 1 second, just in case it shows you when I come up. And then if it doesn't, let me see. Because I'm still getting used to doing this. Okay, good thing you turned it off. So let me go back to here. Okay, now you good, Alexis.
Okay,
Sorry,
I
I'm
just
still
want to
trying to
say
figure this
thank
out.
you so much.
You're
I've
welcome.
spent time and time, nights after nights, like watching you and making sure that I understand it. So I want to thank you. I did pass my CCMA with a high score
Yes.
on the first try. I've never done this before. I want to tell everybody that's going to do their test or has failed, you are not a failure. Just because you failed that test, you can take it over. If you're believing prayer helped a lot. I prayed before I went in there, and I came out, and next thing you know, I passed. So I just wanted to encourage y'all, and to celebrate, I bought myself a cash car.
Yes, I know. That's, hold on. Let me give you
I,
some applause for passing your certification and buying your first car. Cash. Hold on, y'all. Hold on. We got to give her some applause. Congratulations.
and then I did have a question for you.
Okay.
have you ever had a situation or difficult situation with your coworkers, and then how did you handle that?
Yeah. So let me see. I've had a few moments. One situation I had was years ago. I had a coworker who we shared a phone, so we would get patient messages back there. We shared an extension, and
Uh-huh.
so I noticed she was deleting messages that patients was leaving.
Oh no.
So I talked to the doctor that I worked with. I didn't go straight to our nurse manager. I talked to the doctor that I worked with because the doctor I used to work with, she was so like we were like family. Like I used to go to her house and everything. We got really close. So I talked to her about it first and asked her like, what should I do? Should I talk to her first or whatever? So long story short, the doctor, she didn't even give me time to talk to anybody or talk to her. She went straight to the nurse manager. So because she went to the nurse manager, of course, my coworker was upset with me. She wanted to fight me and everything. So again, I didn't match energy.
Right.
What I
Different.
did was, yeah, I did match energy. I just asked for a meeting with all of us. So that way I could let her know what kind of position she put me in. Because first of all, we should not have been she should not have been leaving voice messages. These were patients that were leaving messages. And then I'm like, and then you got me back here, this looking like I'm not doing my job because this is my voicemail as well. You know what I
Exactly.
mean? And I also let her know when I talked to the doctor, I went to her so I can come to you the right way, figure out how to go about this. But it just didn't. She ended up losing her job because that was kind of like a pile on situation. She had been doing other things too. So she ended up losing her job, which is a whole other thing. But I just pretty much asked for a meeting because this is my thing, Alexis. I always try to bring in a third party because I never want anybody to say that I said something or I did something that I didn't do. So I always need that third party there to be able to mediate and then to also be a witness if something happened. Because like I said, she wanted to fight me. So just imagine if I just took her in a room and tried to talk to her and
Hmm.
she could have said I was the aggressor. You know what I mean? So I always just believe in having that third party. And I tell my coworkers this too, because I've had a coworker who had an issue with another coworker, and I told her the same thing. Like, listen, don't go talk to this person on your own, especially and then you gotta kind of know the person because you may work with somebody who is not as aggressive that you can go and talk to with no problem. But when you have somebody that you're working with that is, have the tendency to get loud or violent or whatever, I will always have a third party keep make documentation. So if you notice, I've had a situation with a coworker and I just kind of documented and that's why I say I've had a bunch of situations because it's going to happen working with people. But another situation I just documented, you know what I mean, our interactions and stuff like that. So when I did have the conversation, I was able to say, this is what was happening on this day or whatever. So I will say, guys, just like I say, you're going to eventually come across a difficult patient. The same thing is going to happen at work too. And you just got to kind of not expect it, but when it does happen, just be prepared to know that you got to bring in somebody. You got to bring in somebody that mediator or third party. And then don't go and talk to other coworkers about it. Don't, because that's another thing that can become ugly. Try not to. Of course, we all have our friends at work, but try not to talk to too many people about what's going on with you too, if you can. Somebody said to cover. Andrea said, "Yeah, to cover yourself." Yeah.
Mhm. Okay, and lastly,
Mhm.
what is some advice you would give to someone that's like eager to do travel work?
Mhm. You know what's funny? I actually have a girl that I'm friends with on Facebook that I need to bring on the channel. She does travel MA. I want to start back doing interviews on the channel. I don't know if you guys have seen it. I have a playlist where I've done interviews with different people in different
Yeah.
fields, but I have a young lady that I'm friends with that I want to bring on. So I'm gonna have her on because I've never done travel MA. I know a little bit about it, but I don't
Yeah,
know
I've
a
been
lot.
doing agencies and seeing a lot of agencies, but
Mhm.
where I live in Oklahoma, they only have correctional or hospital jobs available.
Mhm.
So I don't know if it's because I'm new as a CCMA or is it
Mhm.
because when I did my program, they don't have phlebotomy. They only had 1 day of
Mhm.
phlebotomy, so we didn't get our certification in that.
Got you. And that's what they want, somebody who's certified in phlebotomy.
Yeah, so that most of them say you have to draw blood. You don't
Mm-hmm.
have to be certified in phlebotomy, but you have to be a CMA that draws
Okay.
blood. And I'm
Oh,
certified as a CCMA.
so can you go get your phlebotomy
I'm
certification?
actually working on that now. I start
Okay.
classes on the 13th of this month.
Okay, gotcha. But yeah, as far as the travel, I'm gonna have her on, but I can tell you the only thing I do know about it, I was offered a travel position. I just moved to Georgia, but I was in DC at the time and it was in
Woo-hoo.
Baltimore. And I
Congratulations.
thank you. I did not take it because what they were going to pay didn't make sense because I would have had to drive out there every day.
Mhm.
And I do know they give you a living stipend, but it could be, significant, maybe not. But what they were trying to offer me wasn't enough for me to drive out there. Now, if they had said, okay, we'll give you a stipend so you could, rent somewhere while you out here, because Baltimore and DC, that's like an hour apart, not including traffic. So for me, it
Correct.
didn't make sense. I would have needed like a hotel. So I do know that, and some of them do pay really well, and then some of them is,
Pay very low.
yeah, so it just kind of depends. But I'm definitely going to have her on here. I can't even think of her name right now. Oh, I think Brittany. But Brittany, we're friends on Facebook, and I think she's in my group too. But I'm going to have her on here like ASAP to talk about it because
Absolutely.
yeah, I'm gonna have her on here. I'm gonna reach out to her because I reached out to her over a year ago and I still haven't had her on. She probably think I'm playing, but I just haven't had time.
Thank you, Miss K.
You're welcome, Alexis. Okay, let me go back to these comments here. Let me see if anybody else. I'm going to put the call in link in the chat one more time for anybody else that wants to call in. I do see your questions and stuff in the comments, guys, but I try to take the people that's calling in first. So when somebody calls in, I just kind of take a break from the comments. So, but I just put the link in the chat again. Let me go back to these comments. Let me scroll back up. Um, hey Harlem, it's Maya. Hey Maya. The real MK Motion says, thanks for helping me pass. You're welcome. Congratulations. Oh, you are so welcome. I see somebody called in. Hey Brenda, do me a favor, turn your camera off for 1 second while I bring you up. Because unless you want to be on camera, you want to be on camera, you can turn your camera on. If not, I'll keep you. All right, let me bring you up and then go here. Okay, there you go, Brenda. How are you?
Hey, how are you? I've watched you a couple of times now. I'm so excited when I find out that you're on. I used to just be strolling. But I'm a medical assistant. I have been for 30 some years.
Okay.
And I'm coming down, I'm winding down because I'm hoping to retire next year. But I want to teach medical assistant like at a community college or something.
Okay.
I just don't know how to go about doing it or how you found out about the position.
Got you. Okay, so you've been a medical, so you got the experience. I'm gonna tell you, most schools they all they want is the experience. Some of them they want you to be certified. Are you certified, Brenda?
Yeah, oh yes, I'm
Okay,
certified.
perfect. Okay, so all you do, you just look up the medical assistant schools in your area. Just take a minute and just look up all of the schools in your area that's close to you, and then call around and just say, "Hey, I'm Brenda. I've been a medical assistant for this." And you probably don't even have to go into all of this right away, but
Right.
when you do talk to somebody, just let them know about your experience.
Yeah.
Just ask them if they're hiring for instructors. If they are, perfect, what is your hiring process? And then just go from there. They'll tell you what to do. Usually, they're gonna want you. Most schools, I will say, prepare for this. They're gonna want you to do a teaching demo. So I would say just be prepared for that too, Brenda. Like pick like maybe your favorite body system and
Yeah.
and just have something prepared. So I would kind of do that in advance as you're researching the schools. Just be
Uh-huh.
prepared because most of the time they're going to want to see you teach because the experience is going to be perfect. You're certified is being certified is even better. So then just they're going to want to see that you can teach. So just be prepared to kind of teach. And I would just say when you do your teaching demo, just go in there and just ask questions first. Like, what do you guys know if you decide to do the blood system, for an example? What do you guys know
Right.
about blood?
Right.
You think blood is just the red stuff that run throughout our body? Just make it kind of
Oh,
interesting.
okay. So that okay.
Yeah, and then just tell them what it is, and then have like some kind of handouts. Like, so let's say you do the blood I'm using that as an example because that was my first teaching demo when I started teaching. I had
Right.
pictures of the blood cells. I said these, the red blood cells, white blood cells, and platelets. And
Right.
so just have that because that's going to impress them to whoever it is, whether it's the dean or
Oh,
director.
okay.
Yes,
Yeah.
just have something to pass out to them. Be prepared for that because I'm pretty sure they're going to have you do that. So start with calling around, seeing what their
Okay.
criteria is. Update your resume if you haven't already.
Okay.
To just add any kind of training that you did, because I'm sure being an MA all this time, you've been training some MAs on a
Oh
job.
yeah. Oh
So
yeah. Oh yeah.
I will hone in on that. If you don't already have that on your resume, I will add that right away. Train new MAs. Every job you had where you train new MAs, I will add that to your duties on your resume. And then when you do your cover letter, make sure you talk about that as well. Like you can even, mention being a medical assistant for all these years, and many of your positions, you were the trainer of new
Right.
MAs, because that's going to make
Okay.
a difference to them seeing that you were the trainer for
Right.
MAs. Yeah.
And I know I've noticed I've started looking on LinkedIn and stuff. I
Mm-hmm.
see they have a lot of remote
Mm-hmm.
medical assistant positions, or like community college, you can teach from anywhere in the world
Mm-hmm. Yeah.
remotely. So
Now,
okay, so,
community college, I will say, community college is probably going to be still try them, but those are a little bit harder to get into community colleges because
yeah,
not all of them necessarily, but I remember this one community college that I applied to. They wanted to know, like they want to see, they wanted you to already have experience. So I had to explain situations where I had to mediate students and all of that. And I ended up not even applying because it was so much. And I was happy at my job. I just wanted to
right,
do something else. So I was like, this is too much. But I do
right,
know they're going to want more. So I would start with the medical assistant schools, not necessarily community college. So you know how they have like the allied health schools that's just
yeah, yeah,
medical
yeah,
assistant? I would start with those first and then kind of passively apply to the community colleges. Those are
yeah.
going to.
Because I've got a master's too,
Oh, perfect.
so
Oh, you got
in
a
healthcare management. But
girl.
that's why I love to look at
You
you. Because
qualify.
do you have a specific time that you come on, or specific
Random,
days?
random,
Huh? Just ran because I
yeah,
don't like to miss you, and I was just happening to look. I said,
yeah,
"Oh, she's on." Okay, so
random.
yes, so okay, so I'll do that. Allied schools,
And you
and
have
then
a master, so you
yeah,
having
I
a
have a
master's degree
master's.
is even better. Yeah, go for the community colleges. Then I'm thinking you certified. Yeah, you got it. So I will say this too. And I'm glad you brought that up because that you mentioned that you have your degree because a lot of people they ask, should I get my associate's degree in medical assistant? And I always say, if you want to go further,
Right?
definitely get your associates, then your bachelor's, your master's, because what happens is when you do want to go into these schools, like actual colleges, community
Yeah,
colleges, that makes a difference when you have a degree. So
yeah,
that's
yeah. Because my master's in healthcare management.
that's perfect. Yes, you can be program manager. Actually, you
Mm,
qualify. You don't even just qualify for instructing. You actually qualify to be a program manager as well.
yeah, so
You know,
that's why I've been watching you for a while because I'm like,
yeah.
I'm learning from you because I know you've been out there a long time.
Yeah, it's been
But
a long time.
but I mean that's good because you don't
Yeah.
know how what a difference you never, like you say, with this platform that you have, you don't know the difference that you make in other people's lives because you don't, you're doing this, you're not seeing them, but the difference that you make.
Thank
So
you.
but
Thank
I
you. I appreciate
appreciate it.
that. No problem. And make sure your notifications are on. So that way
Okay,
when I do go live, it'll pop up on your phone so you won't miss.
okay,
Yeah.
I'll do that then. I'll do
And
that
keep
because
me
I'm
posted too, Brenda. Let me know, what you find. Start with the
okay,
MA schools and the college. Let me
okay,
know. But you are very much qualified. Very much.
okay. Thank you, darling.
You're welcome.
Okay, bye bye.
All right. Bye-bye. All right, let's see. All right, let me come back to the comments, guys. Okay, 2 points ran out of time. Okay, so somebody said I missed my CCMAA test. Huh? Hold on one second, guys. My daughter. What'd you say? Oh, yeah. Somebody says they missed their CCMA test by 2 points. She ran out of time. So listen, this is one of the reasons why I tell you guys, when you start your test, go through the easy questions first. Any question that you have to spend time on so you won't run out of time, go through the easy stuff, flag the questions that you have to think about. Somebody asked me, how long should I spend on a question? Anytime you got to sit there and think and do process of elimination, just go ahead and flag it and come back to it. Focus on the questions that you can easily answer, okay? And then come back. So that way, if you run out of time, you will have answered enough to still pass. I've had students who ran out of time and still pass. So make sure you flag your questions. Now, for anybody that have, failed the test, you were so close, you are in a good place, because that means that you knew enough to get that close, but you just fell short. So Draca and anybody else who recently failed by a point or two, a few points, look at your detailed score report, and then look at the areas where you fell short. So it's going to say below the passing standard, and just make sure you double down on studying those areas. And I'm going to put my my online study guide into the chat. Actually, just go to marefreshercourse.com, guys. Hold on. There it goes. marefreshercourse.com. It's on the screen. marefreshercourse.com. And then for you, Draca, and anybody else that's taken an administrative test, Draca, you would get the administrative study guide. You don't need the clinical one. You get the administrative one. And that's going to help you as well. So online study guide is marefreshercourse.com. I'm going to type it into the chat as well. I normally put the direct link, but the direct link is only going to take you to the clinical one. So marefreshercourse.com is there in the chat. When you go there, you're going to see a clinical one and you're going to see administrative one. For you, Draca, you're going to get the administrative one. It has, I think I have 5 modules in that one. You have a video and you have a quiz, and then you have practice questions. That's going to help you pass the test your next time. Because you got close. This shows that you know the information, you just fell short in a specific area. Now you need to look at your detailed score report to figure out what that area was. And then the clinical one is for anybody that's taking the CCMA, the RMA, the CMA, AAMA. Okay. Oh, shout out to this person for becoming a member. Shout out to all the members. Shout out to you guys. I usually make videos available to my members first. So like when I post a video, which I haven't done in a while, I've just been going live. But when I chop these lives up into questions, I will make those available to the members first. And I've gone live for the members only as well. So shout out to everybody that's a channel member. Hey, Nyla. Hey, Amber. How's everything going, Amber? Oh, McKeever says it's McKeever. Okay, sorry about McKeever. Sorry about that. Andrea says I'm late, but how was the BET Award? She asked that because when I was live last time, I got off so I can go watch it. It was really good. It was funny. All right, let's see. They're telling you congratulations in the chat. Hi, Miss K. Thanks for the video for the CMA. I need them. You are so welcome, Teresa. Oh, thank you, Jasmine. Oh, Andrea says I want to do labor and delivery or dermatology. Speaking of labor and delivery, y'all know my child is about to have a baby and oh, matter of fact, let me put the links to her. Somebody asked me, I don't know if she's on here. I'm not going to say, I try not to put people out there, but somebody asked me for my daughter's baby registry. So I'm going to put that in the chat. You don't have to ask me twice. I said the next time I go live, I was going to post it. So let me put it in the chat really quick. But yes, it is true. I know I'm young. I know I'm looking super young right now, y'all, but it is true. My daughter looking like bye, because she don't think people tell me I look young. She don't think I look young. I'm like, yes, people say I look young, but she is having a baby girl in a few weeks. Her baby shower is actually on this Sunday coming up. So I'm going to put it in the chat for anybody who wants to get anything. The young lady asked me to post it, so I'm going to just put it here. Baby registry. Yay. I'm going to put it in there. She said I'm not young. I'm still young. All right, let me see. But I think labor and delivery would be nice, Andrea. That'll be interesting. I've never worked in labor and delivery. I worked for an OB. So the doctor I work with, she delivered babies, and that was nice because she was a obstetrician, but she was also family practice. So I was able, and I was with her for 4 years. So I was able to see the mother go through the pregnancy, and then her baby comes in, and I'm the one giving the baby their injections, their vaccinations, so I did love that aspect of it. My little babies. I sent my reference to this. Okay, care clinic. I applied and already had an interview, just waiting. Okay, good luck with that, Amber. Good luck to everybody that is trying to get a job right now. Something is going to come through. Yes, and your dream says I got my first MA job in family practice. Congratulations. Let me do some more applause. Applause to everybody that has recently got your job, that has recently passed certification. I am so happy for you guys. Nikki says, I'm here too. Mommy Vision says, I did medical terminology, I was going to do medical assistant class to realize I really just love. Okay. And this is good. Let me put this. This is so important. She said I was going to do medical assistant, but then I realized I just love the paperwork side. And that is totally fine. Some people realize that they only want to do the administrative side. Somebody asked me, should I do administrative or should I do clinical? I always say, think about what you want to do. If you don't want to deal with people hands-on physically, like dealing with blood, urine, taking vital signs and all of that, then you don't have to do that. You can do the administrative side, so I'm glad that you pointed that out, that you realize you just like the paperwork side of it. After NHA, CMA, I obtained a scheduling position at the VA and I love it. That's awesome. All right, let's see what else you guys are asking. CCMA test last week. Congratulations, Joe. Jessica says, how's everyone doing today, y'all? Let Jessica know how everybody's doing. How you doing, Jessica? I'm doing pretty good, Jessica. Watch your whole study. I passed. Congratulations, London. Let's see. Can a medical assistant have a master's degree? So I don't know if any medical assistant master's degree, but you can get an associate's master's degree and then you can get other degrees. You can further that degree. The Brenda who called in, she has a master's degree in healthcare management. And so, you can be a medical assistant and have a master's degree in, another field, but not necessarily in medical assistant. To be a medical assistant supervisor, do they have to have a master's degree? This is a really good question. So, Jessica, it depends. So, when you are in a private office, you could literally just be a medical assistant with experience, right? And work your way up to being a manager. They don't necessarily have a requirement of having a degree. When you get into like your bigger companies, depending on what that is for you and your area, those are the ones that's the big healthcare systems. A lot of times, if you want to be a manager, they require you have a master's degree. If you want to be like a lead MA or maybe an assistant to the manager or something like that, you don't necessarily have to have a degree. And again, it just depends on where you work. So like more private offices, you can, like I remember my very first job when I became a medical assistant, my office manager, she was like 25 and she had been a medical assistant, I think, for like 4 years. And we were in a private GYN office though. So it just kind of depends. You can work your way up, and then, like I said, it's the bigger companies that really want you to have a degree. Like if you want to be like the administrator of the practice or, but if you want to be like a lead MA, like I said, you don't have to have a master's degree because a lead MA is considered somewhat of a supervisor, but not a manager. Let's see if I see any more questions. Currently about to enroll in. Oh, you here early. Okay, Desiree. Desiree said, I'm currently about to enroll in CMA class. Nervous, but so ready to start. Let's give Desiree some encouragement, you guys. So I'm glad you're here. I'm glad you got your early start before you even, start class. Just make sure, don't get into any of the certification information yet. I don't want you to get overwhelmed. So don't go into the study videos yet. Just watch the clinical stuff. So like the vital signs and the injection, blood draw, stuff like that you're going to be doing in class. You can watch those as you go, but don't get too, caught up in the certification stuff because you're going to get overwhelmed. And then Andrea says 1 minute per question. Yeah, you don't want to spend a lot of time on your questions because, that's how you run out of time. Flag those questions and then come back to them. Okay. Oh, Nicoya says, I'm a member too. Yes. Jessica says, I'm a member too. Yes. Shout out to my members. Shady says, I'm from Milwaukee, currently in class with simulation. Simulation next week, a test. just look at some videos before you go. So Shady says they're having clinicals next week. So all you do is just look at some videos before you go. I always tell people that. So depending on if you know you're going to be doing EKGs, just look at some EKG videos, injections. If that's what you guys are going to be doing, look up those videos, and so you can be prepared when you go in. Jessica says, congratulations on becoming a grandma. Y'all calling me grandma in the chat. That is so funny. Thank you guys. Andrea said, yes, you do. Look, see, Jasmine said, my daughter, she not right here right now. She said, I look 25. Thank you. Andrea says, hey, Andrea. Hi. Andrea, I'm going to be sending you an email. So, Andrea, I am live on YouTube right now and Facebook. So, right now, I'm just doing a Q&A. I'm so glad you joined me because I'm definitely going to send you an email because I actually want you on my channel to talk about what you do, because I've been seeing your stuff coming up. So I'm so glad you are here. But some of the stuff I do, I go over certification practice on this channel. And then lately I've just been going live at random times, just answering questions. People have been calling in with questions and stuff. So that's what I do here. And then I upload. So you're on Facebook. You're not seeing my YouTube right now. But on YouTube, I do clinical videos and stuff like that. And so, yeah, all things medical assistant. So that's why when I saw your post, and make sure y'all follow her, Andrea, her Purpose Co. If y'all are on Facebook, make sure y'all follow her because she's doing big things. That's why I reached out to you, because I wanted you to come on the channel so we could talk about what you do, because I was impressed. She's an MA who has been able to earn 6 figures. And I love to have people on the channel that are doing big things. I had a couple people on here who own their own school. They went from MA to owning their school. And then I had one girl on here. She's a tax preparer. She was a medical assistant and then earning 6 figures on the side in her business. So, and then I had my friend on here. We started as medical assistants together, and she's a nurse practitioner now. So I do want to get back into interviewing people. So that's exactly why I asked for your information, Andrea. So I'm gonna be reaching out to you. She said I would love to. Yay! I started in podiatry, and I'm trying my best to keep up with the clinic flow. Any suggestions? So I have worked in podiatry a little bit. So at one of my practices that I work for, we had podiatry, infectious disease. We had so many different practices, and we could end up in any one at any point. So I've done it a little bit, but I don't know what you do in podiatry. So the podiatrist I work for, we didn't do much. All she wanted was vital signs. And then we just had to have the patient remove their shoes. So I don't know what all goes into your flow, Charmaine, but that's all she wanted us to do was get their vitals. I don't even think we got their weight. I think we just get their blood pressure and pulse and then had them remove their shoes, and she did the rest. So I'm not sure, but so, keeping up with the clinic flow with any specialty, not necessarily podiatry related, pacing yourself, your task and everything, just kind of having keeping sticky notes to remind you of certain things. I live by sticky notes. Like, matter of fact, I have this right here. I had this at work, and this is what I had on my desk at work, and I still use sticky notes. So using sticky notes to stay organized. And then, of course, looking at the schedule, being prepared for what's coming in. I don't know if your doctor does any procedures or anything, but just be prepared for the day, try to prepare at least a few days out. And then, of course, the day before, see if any other patients were added so you could be prepared for whatever's coming in. Have your supplies ready. Make sure they're cleaned, for the next day, whatever it is that your doctor is in need of. Just make sure that stuff is clean and ready. Thank you, Charmaine. Andrea says, I got a job and haven't even taken my test yet. That's awesome, Andrea. Congratulations. You brought up a good point. So there are some people that will hire you without your certification, guys. So I definitely want you to still apply. I definitely want you guys to still, let me see. Oh, okay. Oh, her Kelly. Oh, okay. Gotcha. So Andrea's answering that question. Sorry guys, I'm gonna skip to this really quickly because she's referring to the question that was asked about if you need a master's. Andrea says, no, you don't. I'm a medical assistant and now an operations healthcare leader with my certification. Awesome. Thank you for sharing that, Andrea. That's why, I need to get you on here. So, oh, what I was saying is that you can get a job before you get certified. I do recommend you guys to still get certified, definitely. But there are a lot of places that will hire you. Some will give you some time to get certified, but either way, eventually you will need to get certified. So I definitely recommend still getting certified, but you can still, apply in the meantime. Harlem says, I love both clinical and administrative. Me too. If I had to pick, I would stick with clinical, but I like the administrative side too. I'm about to start. Oh, what's the biggest advice I should do? Oh, I already told her. Desiree, I ended up answering your question. Well, I didn't get into so I would say, I know I gave you a little bit of advice, but I would say also, like I said, don't get too much into the certification videos just yet, but just make sure you have a study schedule too and stick to it. So whatever days you're going to, study certain topics, have those days set and then stick to it. Turn your phone off, guard your time. Okay. Bless you. Guard your time. And however that looks, whether it's turning your phone off, turning the TV off, having your music on, whatever, or maybe you need it absolutely quiet. Don't go home and leave school at school. When you go home, you should be doing your homework. You should be studying. Have your notebook separate, have your administrative stuff, your clinical stuff. And then in your notebook, I would separate it by topic. So like your cardiology stuff, your phlebotomy and all of that, because when it's time to take certification later and you want to go back and study certain things, you have them broken up into sections versus all together. The best thing to do is to stay organized. Most people get overwhelmed only because they're unorganized. So if anybody is in school, you feeling overwhelmed, you're probably unorganized. You just need some organization. That's it. Sometimes I feel because it's been off since I passed my exam in school, I have had several interviews, and I get it, Amber. And I do want to speak to that because there's a lot of people who are dealing with that. I've had students who have gone through the same thing. So I definitely want to take a moment to just give some encouragement to Amber and anybody else who has been out of school, and you've had a hard time finding a job. I know a lot of you guys have done a lot of things I've told you to do. You've been going out to the offices and passing your resume out. So I want to give you guys some encouragement because something is going to come through. I know it's easier said than done because I'm not in that situation right now, but I have been. This is what I want you guys to understand. Years ago, I left a job. I didn't have one lined up. And I'm just thinking, oh, I'm going to go right out here. I'm going to find a job easily because, I got all this experience. I had been teaching and I left that job planning on taking a break. And then when I went to go try to find another job, I'm thinking I'm going to get hired right away. That didn't happen. I got humbled real quick. But anyway, I just shared it to say that it took me about 3 months to find a job. And I was going out. Everything I tell you guys to do, I was doing that. And what's crazy is that I ended up getting, once I did get a job that I loved, all those places started calling me back later. But anyway, I just shared it to say that I've been there. So I don't ever want you guys to think I just say this just to say it. I say this because I've been there. 3 months of searching, application after application, going out, passing out my resume and all of that. I mean, in the rain, going to these different places, and something finally came through. And it was the best thing. Like even to this day, I still work for the company. I ended up working there for like 4 years and then I left and came back and I'm back at the company now. And so many good things come from that. And I share that to say that when it does happen, when you do find something, you're going to realize why nothing else worked out, So I would just make sure you guys have your resume edited, professional resume services. You can look up the MA specialist. She's on TikTok and she's also on YouTube, the MA specialist. Her name is Jasmine. Everybody I've sent to her has given her great reviews, but her name is Jasmine. So get a good resume. Also a cover letter. So make sure that's not. And then also, I've given some interview tips on the channel, but I think I'm going to do a little bit more on that just to help you guys out. Just because for people who are having interviews and not getting hired, that could be it. Could be not though. You could be interviewing great. Could be just not a good fit, But I just want to let you guys know that I do see you, I hear you guys, and I can relate. And something is going to come through. I'm praying for you guys. I really am. Something is going to come through. Jasmine says, I don't have a degree, but I've been a lead MA, preceptor, and now I'm a clinical practice supervisor. I love that. See, you absolutely can You absolutely can be a supervisor without your degree, Jessica. I took the baseline NHA practice test, was so nervous. That's good. That's good. Oh, Harlem says you passed my, which comment, Harlem? What comment did I pass? Let me see. I'm sorry, Harlem. The only thing I see is when you said I love clinical and administrative. Maybe that one was it. Interested in becoming an MA this month. Awesome, Betty. I passed my exam a month ago. I'll be working while a full-time college student. What type of specialty would you recommend for a full-time student? I love the job but require flexible schedule. So you can look into PRN positions. Full-time. Sheesh. So you need something. I'm guessing you're going during the days. You need something in the evenings or PRN. I would say look at some evenings and PRN positions since you're a full-time student. Part-time, look into part-time and PRN buy-in. Is that buy-in? Hopefully I said your name right. PRN and part-time positions. Congratulations, Deborah, passing with a 401. All right, let's see. Are you familiar with the Cleveland area? Not really. My daughter was going to school out there, but I'm not really familiar with it. Do you know which hospitals I deal? I don't. As a beginner medical assistant, you want to be in a specialty, and I didn't mean to say specialty. I meant to say you want to be in a clinical setting. Not necessarily. I mean, you can start out in a hospital, but if you go to a hospital, if you're inside the hospital, you'll be doing like phlebotomy or tech type of work. So you want to look into ambulatory settings. You want to look into clinics versus being in, unless you're in a professional building, you're in one of the offices connected to the hospital, then that's different. But I wouldn't necessarily say as a brand new medical assistant work inpatient, because inpatient, like I said, you're going to be doing phlebotomy and or working as a tech, and then your hours, you're going to have those hospital hours. But if you want to, of course, go for it. I don't want to discourage you if that's what you want to do. But if you're asking if I think that's ideal, I don't think it's ideal, but unless you want to do it. Wow, congratulations. Oh, I highlighted the wrong comment. Congratulations. Y'all, let's congratulate Harlem. Congratulations, Maya. She says, I got accepted into the doctoral program, public health track. That is awesome. Listen, Maya, I might got to have you on the channel because Maya, since you've been coming on here, you've been doing big things. Maya, always, I'm telling you, you have shared some awesome. I got to have you on here, Maya. They're telling you congratulations in the chat. Okay, got you. Okay, Abby, you helped me so much. I think I want to do part-time, and told me, yeah, definitely do part-time. I think you should do part-time since you're going to be a full-time student. She said, I told my friends about your channel. Awesome. Thank you. I can pass if I just use the study guide. Yes, you can. And I don't want to say, so I don't give 100% guarantee to anybody because I don't know. I don't know. I definitely have a higher passing rate between my YouTube videos and my study guide, and then also my students. However, I never give 100% guarantee because I don't know anybody's areas, where I don't know anybody's weaker areas. I don't know, I never give that because I just don't know. So I would never say 100%, but I will say absolutely. I can say absolutely people have been passing from my YouTube channel and people have been passing from my study guide. That's one thing I can say. But I never give 100% guarantee because I don't know. I don't know anybody's, because I have students who have, who have had a language barrier and couldn't pass. I've had a student who had a learning disability and couldn't pass. I've had a student who, had testing anxiety. And so she ran out of time and didn't pass. So I never, ever give 100% guarantee, but I can tell you that people absolutely, when you look at the comments on the study videos, people are talking about how they pass from the videos. My study guide, I wish there was a way that people could leave reviews on the platform. I need to figure out how to do that so people could leave their reviews there. But I've had a lot of people pass from using my study guide as well. So I would say yes, you absolutely can. Yep, you absolutely can pass, but I won't say you will. You absolutely will, but you definitely can. They're telling you congratulations. Jasmine says Harlem is the queen. I know that's right. From inmate to doctor. Yes, yes. We are here for it. From inmate to doctor. I love it. I love it. I love it. I love it. Okay, y'all. Let me know if y'all have any other questions. I have been on here for 50 minutes and y'all are still on here. Let me leave the link one more time for I'm going to leave the link in the chat one more time for my study guide. And also, wait a minute, let me leave my the call-in link one more time if anybody wants to say anything really quickly before I get off here. And then I'm going to leave the link for and then I'm going to leave the link for the study guide again. So if anybody is watching this and you're preparing my study guide, I'm putting in the chat. I'm putting a direct link to the clinical one because that's the one most people are taking anyway. If you need the administrative one, you just go to marefreshercourse.com to pick the administrative one. But if you need the regular one just for MA certification in general, this is that link. I see somebody. Okay, Maya. All right, Maya, let's get you on here. Let's see. Hi, Maya.
Hi.
How are you? It's nice to hear your voice.
It's good to hear your voice too. I'm
How-
doing well.
That's
I'm
good.
overwhelmed. I'm excited. Filled with so much joy. I love to
Yes.
see you on all the time. As I said, you helped me while I was in school. So I really big up you and all the things that you do in
Thank
support
you.
of us as we get through our journey.
Yes,
So
and Harlem, I appreciate you for being on here because you from the moment you joined, you were like sharing everything you do and stuff. I said, "Look at who is this?" Because I remember you were telling me about. I can't remember what it was, but it was just I think it was a program you had just finished. I think it was when you first got on here.
Yeah. So when I first got on, I was actually I started off as an MA with
Mm-hmm.
wanting to become a PA,
Mm-hmm.
and then in the interim, I realized that I just didn't want to do. I didn't want to at that time. I didn't want to do patient care. I didn't want to be hands on.
Mm-hmm.
And so I went and got my bachelor's in business administration with the healthcare systems management.
That's what it was.
And then while I was doing that, I became a drug counselor because I had a lot of clinical medical case management in my
Mm-hmm.
background. And so essentially, I ended up getting a master's in healthcare administration with a concentration in health informatics because the data is where the money is. I'm letting you all
Mm.
know that now. The data is
Listen.
where the money
Listen, y'all
is.
hear that? The data is where the money is. Somebody put in the chat, the data is where the money is. Put that in the chat.
And so because my specialty is infectious disease and sexual
Okay.
health. So I did a lot of epidemiology
Okay.
and interventions and evidence-based interventions. So for me, my doctoral degree is going to be in public health. But I do plan on teaching and actually going back and finishing a nursing degree. So I want to also become a nurse practitioner, a psychiatric nurse practitioner.
Wow. 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 I love it. I would you be willing? I mean, I know you're talking right now, but like, would you be willing to come on the channel one day and talk
Oh,
about your journey?
absolutely,
Yeah.
absolutely. I want to talk. I would love to also help folks to not be so focused on what you like. Like it's okay not to know what you want to do, right? Or to
Mm-hmm.
start something and to make the decision along the way. I think what folks don't tell us as we enter academia is that we don't have it all planned out, and sometimes those things change. And I watched that in the last 10 years. Like I've only started school 10 years ago, so
Mm,
like,
wow.
so although I've done a lot of stuff within the field, most of the stuff that I've done really MAs do. So getting my degree as an MA only kind of solidified the work that I was already doing.
Wow. I love that. I'm so glad you shared that. And I think that you are being You definitely an inspiration for me. I don't think you're being an inspiration for everybody. Even when you're commenting in the chat, like every time you're on, people are responding like, wow, you know what I mean? So I definitely want to have you on to talk about it, because I want to talk, I want to hear, more about your story and how, what made you even get into the medical field, and, what made you want to keep going. Because I think there's a lot of people too, like you said, that don't know what they want to do, and maybe hearing you, they may hear, for somebody, this may be the first time of them hearing about informatics. You know what I mean?
Hmm.
So I think that you definitely have a lot of value to share. So I definitely want to get you on here. We just got to figure out a day to have you,
Absolutely. Let me know how I can help and support
send me a,
anyone.
can you have my email, Maya?
Yes, I'm a member, so I got you.
Okay, yeah, send me an email. So that way, I can email you, and then we can set something up, because like I said, I want to get back into the interviews. I was doing it for a while, and then of course I moved and all of that. So I want to get back into that, because I want people to just not just hear from me. I want people to hear from other people, because clearly you have a lot to offer. Like I couldn't tell you guys the first thing about informatics, except that I've had quite a few coworkers that were actually going to school for that as well.
Yeah, or even expanding, right? So
Mhm,
I was doing like I said, I was doing sexual health, right? So most of
mhm,
my I had a lot of you know doing case management for people who are HIV positive. That even got into like comorbidity, so behavioral health, substance
mhm,
use, hepatitis C. So then, as I started to elevate in in within that field, substance use became evident, right? And so I
mhm,
became a licensed substance use guy. So a lot of the things we do move into different specialties or expand into different specialties. I think
mhm,
that's where where I was able to excel, because when I was doing my externship as an MA, I
mhm.
started off in pain management, and it was something
Okay.
I didn't wanted to do. But when I was in dermatology, I loved it, right?
Mhm.
So we got to also think about, like, certain specialties is just not our bag, right?
Yes. Yeah. Yeah. Yeah.
Yeah.
I'm gonna let you answer this. Jessica said, "Where did it go? Wait a minute. Where her question go? Oh, there she go. Jessica said, "Can you make six figures or more with a master's degree?"
Oh, absolutely, especially with the informatics degree. You're a data analyst.
There you go, Jessica.
Right now, I'm a utilization manager. So what I do is prior authorizations, right, for a substance use program. So I have about 36 residents that I call insurance and keep doing, authorizations. But because of my informatics background, I can create data, or I can create charts that'll predict and help mitigate readmission rates.
Wow, wow. Um, I thought I saw another question that I was gonna put you on to as well. Hold on, because you're in New York City. I'm
Yes.
sorry, listen. Maya, like, I ain't signed up for all this. Hold on.
No,
When I
you're
saw New York
fine.
City, I said, hold on, let me let Harlem herself answer this. I don't know anything about this. Can I challenge and take the MA certification test in New York City? Do you know anything about that challenge the
So
test?
New York, well, I I can, because I used to work for the health department, so I know
Mhm,
I can say a lot of as it pertains to New York, but the NHA is fine in New York City. And I encourage a lot of folks here to actually get, because I got my associates in medical assisting, to do it in medical assisting, because then you're able to, if that's something that you didn't want to do, you could actually further a bachelor's degree in any hospital gets you into a management position, right? So it's not that I feel like, to me, it's a door to walk in, to just move around in within the hospital, if and long term, be an MA long term, right, is not the goal. But I feel
mhm,
like, for the most part, as long as you have here in New York City, for the hospital standards, you just need, you don't even need to see the CCMA. They really look for, well, private hospital sectors, yes. The city hospital requires, like, what is it, the EKG and phlebotomy.
mhm.
And you can do that with NHA and be certified and active, and then you can be like an ER tech or what have you. Of course, you need to BLS and all that other stuff, and they'll train you. But here, I don't really see a problem when it comes to working in the hospital with the CCMA. It's more so having the phlebotomy and EKG.
Hopefully that was helpful to you, Estrella. Thank you for sharing that, Harlem.
Yeah.
And somebody put in the chat, looks like they are going from CCMA certified. Is that EKG tech, CPT, phlebotomy, and then now studying data. Okay. Wow. Awesome.
Yes.
Okay, guys, I am going to get off here in a moment. And Maya, definitely thank you for hopping on here, and we will set something up so I can actually
Absolutely. I'm gonna
interview
email
you and
you.
hear more of your story too. And then we
Absolutely.
come up. New member, shout out to is that I don't even want to say it wrong, so I'm just gonna say A. Shout out to A. A7841. All right, guys, I'm going to get ready to get off here. Thank you for everyone that called in. Maya, Brenda, who else called in earlier? Alexis and MJ. Shout out to you guys for coming on. Somebody says so for the study advice, Nyasia. Well, yeah, I was about to direct you to the to my playlist, but I could just tell you really quick, Nyasia, just make sure you have the test plan downloaded. Just go to Google, download the RMA test plan, look up RMA test plan, and then use it as a guide. Okay, check off everything you already know. Go back and find the things that you did not check off, a highlight. And then when you go to take your exam the day of, make sure you're flagging anything you need to spend time on, and then go back to the harder questions later. Have a study routine, have a study schedule as well. And make sure you check out the playlist on YouTube. Okay. All right, guys, I'm going to get ready to get off here. It has gotten darker since I've been on here. And Jasmine says, good luck to everybody that's about to take your test. Yes, good luck to everybody. Oh, do me a favor, guys. If you haven't already, make sure you like the video for me, especially those of you on YouTube. And when you go out the chat on YouTube, you should see the option to hype it. So if you can hype the video as well, that will be awesome. And if you're watching on YouTube and you're not subscribed, make sure you do that. Okay. Love you guys too. Y'all have a good night. I'll see you guys next time. And let me put my thing back on here because there we go. All right, guys. I'll see y'all next time.